Difficulty breathing emergencies are a frequent challenge for paramedics, requiring quick decision-making and effective treatment. Understanding the nuances of asthma attacks, chronic obstructive pulmonary disease, COPD, and emphysema is crucial to providing optimal care. Below we'll break down the conditions and outline appropriate interventions and medications paramedics can use in the field. Asthma attack with wheezing asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, often leading to wheezing, breathlessness, and chest tightness. During an acute asthma attack, airway constriction can severely impair gas exchange, making immediate intervention critical. Signs and symptoms: audible wheezing, particularly during exhalation, shortness of breath, use of accessory muscles to breathe, cyanosis in severe cases. Altered mental status due to hypoxia in critical attacks. Paramedic treatment: assess and monitor. Evaluate airway patency, breathing, and circulation, ABC. Use pulse oximetry to monitor oxygen saturation. Oxygen therapy: administer high-flow oxygen via a non-rebreather mask or nasal cannula to maintain SpO2 94%. Bronchodilators: administer nebulized or metered dose inhaler, MDI, albuterol, 2.5 milligrams nebulized or as per protocol. Anticholinergics: add ipratropium bromide, 500 mcg nebulized for synergistic bronchodilation. Corticosteroids: consider systemic corticosteroids such as methylprednisolone, 125 milligrams IV, to reduce inflammation. Epinephrine in severe cases: administer intramuscular epinephrine, 0.3 milligrams of 1,000, if there is no significant improvement with other treatments. Chronic obstructive pulmonary disease, COPD encompasses chronic bronchitis and emphysema, both of which result in airflow limitation. COPD exacerbations can mimic asthma attacks but often present differently and require tailored management. Signs and symptoms: progressive dyspnea, chronic cough with sputum production, wheezing, prolonged expiration, signs of hypercapnia, confusion, headache. Paramedic treatment: assess and monitor. Check ABCs and monitor SpO2. Watch for signs of respiratory fatigue or failure. Oxygen therapy: administer supplemental oxygen cautiously to avoid hypercapnia. Aim for SpO2 of 88, 92%. Bronchodilators: use nebulized albuterol and ipratropium bromide. Corticosteroids: administer systemic corticosteroids to address inflammation. Non-invasive ventilation, NIV. If the patient is experiencing respiratory failure, consider continuous positive airway pressure, CPAP, or bilevel positive airway pressure, BiPAP. Emphysema, a form of COPD, involves destruction of alveolar walls, leading to decreased gas exchange. Patients with emphysema may present with pink puffer symptoms, such as pursed lip breathing and a barrel chest. Signs and symptoms: severe dyspnea, pursed lip breathing, hyperresonance on chest percussion, minimal cough or sputum production. Paramedic treatment: oxygen therapy. Use low-flow oxygen via nasal cannula to achieve SpO2 of 88, 92%, avoiding oxygen toxicity. Bronchodilators: administer albuterol and ipratropium bromide as needed. Non-invasive ventilation: apply CPAP or BiPAP to improve oxygenation and reduce respiratory effort. Transport: ensure rapid transport to the nearest hospital, continuously monitoring for signs of respiratory failure. Medications for pre-hospital care: paramedics have access to several key medications for managing asthma, COPD, and emphysema emergencies. Albuterol, a beta-2 agonist that relaxes bronchial smooth muscle, relieving bronchospasm. Ipratropium bromide, an anticholinergic that complements albuterol's effects. Corticosteroids, such as methylprednisolone, help reduce airway inflammation and prevent recurrence. Epinephrine, used for severe refractory asthma attacks to quickly alleviate bronchospasm. Magnesium sulfate, occasionally used in severe asthma to relax bronchial smooth muscles when standard treatments fail. Summary: asthma attacks, COPD exacerbations, and emphysema emergencies require paramedics to distinguish between conditions and apply appropriate treatments rapidly. While asthma often presents with wheezing and responds well to bronchodilators, COPD and emphysema demand cautious oxygen administration and may benefit from NIV. By mastering these interventions and understanding the underlying conditions, paramedics can effectively manage respiratory emergencies and improve patient outcomes.